8:34. You know, hair loss is a topic that nobody wants to deal with, but unfortunately, it's a fact of life for a lot of men and women too. So with us this morning to talk about it is Arizona transplant surgeon Dr. Shelly Friedman. Thanks for being here this morning.
Thank you for having me.
Dr. Friedman, you actually have written a new book, To Bald or Not to Bald. That is the question. And basically, you want to set the record straight on male and female hair loss.
Yes, there's a lot of misconceptions as far as what causes hair loss in men and women. It's usually due to a hormone called DHT, dihydrotestosterone. But in women, there are other things that can affect that. And so the treatments are totally different in most cases.
Is there a lot of misconception on women hair loss? I've heard of things like alopecia, problems like that.
Well, alopecia just means hair loss.
Okay.
But there's reasons why people can have alopecia. It could be from thyroid problems, either hypo or hyper, too much or too little. It could be from iron deficiency anemia. It could be from certain medications. It can be from stress. But normally, 95% of all hair loss in men and women are due to just hormones called female pattern or male pattern hair loss.
So how you treat it, because it's different, the hormone is different in men and in women, has to be different in how you treat man versus a woman, correct?
Exactly. In men, the primary treatment for men is hair transplants, where we take genetically programmed hair from areas where we know they'll never fall out and transplant it up to where they lost their hair. With women, we also do transplants, but sometimes their donor area, this area back here, the safe fringe, that area isn't safe anymore because they've lost some of that hair.
Let me ask you to hold this picture up. This is a before. This was actually a patient that you had who underwent laser therapy, and we'll take a closer look at that. Tell us what this woman was dealing with. Is this pretty average problem here?
Well, what we don't realize with women is the fact that there's 30 million women who are suffering from hair loss, 40 million men. Now, if you take a look at this picture
and here's the after. Wow. This is the same woman, no transplants.
No transplants. This is just laser. Women do best with laser.
How long did it take for her hair to grow this way?
1 year.
1 year of treatments.
1 year.
And how often are the laser treatments being done?
It's 3 times a week for the first month, and then it's twice a week for the next couple of months, then it's once a week after that.
All right.
And then we put you on a maintenance program that could be once a month, it could be twice a month. There are also some units that you could use at home so you don't have to go in the office.
Okay.
But with women, the best results we're getting is with laser, because what women do, unlike men bald, women miniaturize. They get thin. And the problem with women today is the fact that society, if you see a man who's balding, you don't think anything about it.
It's okay, sure.
If you see a woman who's thin, your eyes stand out. There's very few news anchors who, men or women, who are balding. There are very few actors. There are a couple, but there are very few actors who are balding. Most
or at least showing it, right?
Exactly. In society, we think that women should look like a Jessica Simpson, somebody like that.
Full
with long,
big hair that has just come out of a salon.
And that's where this really helps, to go and to bring in, to revitalize the hair. And it's non-invasive. They just sit under it. It almost looks like a hair dryer.
Wow. And how long of a treatment is each treatment? Like
30
3 minutes? Okay.
30 minutes. And they just sit under it. And again, it's non-invasive, so you don't feel it. It's a laser that's a cool laser.
And I want to show the picture of the book right now. This is a patient, a man who had hair loss and then actually had the transplant. Is it the same kind of results that you're seeing with the women in laser versus the men with the transplants, or is one better than the other?
Well, hair transplants are better for one reason: they're permanent.
Okay.
So whereas
there's no maintenance.
There's no maintenance. This man's going to look the same in 40, 50, 60 years. And the nice thing about transplants is it's your hair. So it's more of a surgery, and it's more invasive than obviously laser, but the results are staggering. And for a man who usually has a thick head of hair back here, we can
we often
replace it.
see that ring around here where they start to
And
bald.
in the book, we talk about the causes of hair loss. Again, there's a lot of misconceptions of what works, what doesn't work.
Okay.
There's a lot of products on the web that people buy into, and unfortunately they're plying on people's emotions.
Where can we find your book then?
You can contact us at our office at 480-970-0300. It also is going to be on Amazon.com within the next couple of weeks.
Okay, very good. And we'll make it easy for folks, put a link on our website and all your information there. Dr. Friedman, thank you so much for shedding some light on what baldness is really all about.
Thank you.
Okay.
Thank you.